Welcome to Paladin Financial Talk. I'm your host, Jeff Quick, and I am more than honored to be joined today by Mr. Dr. Professor Tony Shore. Welcome, Tony.
Yeah, I do believe there should be a doctor in there somewhere. I'm not a real doctor, Jeff, but I play one on the radio. So
Perfect.
that is my radio name. That's my old DJ name from the 80s, Dr. Tony Shore. 99.5 FM, WLOL with Heinz and Berglund in the morning. I'm your co-host, Dr. Tony Shore.
Yes.
How about that?
That's awesome.
How about that? Now, before we get into our script today, Jeff.
Yes.
How have you been? Have you had a crazy week because of this past Monday? We had people started to panic. I opened up my web browser to cnbc.com on Monday morning, this about a week ago now, and it said recession fears grow as market falls,
Yes.
sell off. The sky is falling.
Yes. Yeah. More busy than usual, especially for a Monday, right?
Sure.
Because the prior week, Thursday and Friday, market had started to decline 2 days in a row.
Sure.
And then we had a big sell-off on Monday. We had the jobs report the prior week.
Yeah.
We had some stuff taking place in Japan.
Yep.
A lot of stuff going on.
The Fed not lowering interest rates.
Correct. So there's a number of things coming into it. We had a few phone calls. Actually, we had our Monday morning meeting, and I said to the other advisor, which of us is going to get the first call from one of their clients panicking and wanting to go all to cash?
Yeah, which you shouldn't do. And it illustrates what happened is the market. First of all, the market wasn't even down enough the market was still up overall for the year.
Yes.
But the worst of it was first thing Monday morning. And by the end of day Monday, it had already started to recoup that. So,
started to come back a little bit, came off highs. You know, we've had a couple of good days. Last I looked, we're up 1.5% or so today.
Yeah.
So I don't think we're all the way back yet,
No.
but very close. And it goes just to prove the point, right? Don't panic.
Yeah. It could go down again, 5-10% tomorrow and have a correction because we've been hitting all-time highs for the last year. So
correct.
Corrections are going to happen. But you definitely shouldn't go all to cash then, because what you want to do is be contributing during those times if you can, if you're still working,
100%.
right? Yeah.
It was interesting because I had a number of new clients I had brought on board over the last couple of weeks, and some of them were disappointed. They missed out on some market gains while their money was transferring from, one custodian to the other. And now inversely, as I told them, I'm like, well, sometimes it works in your benefit. Sometimes it works against you.
Sure.
Well, I had several others that had money sitting in cash waiting to transfer into various investments that missed out on all of those losses, happened to come back in on Tuesday when the market started going up. So it can work out either way.
Sure.
Nobody knows. For sure.
But people people want to panic, but that's why you do what you do. And that's why the Paladin team is so essential, that you work with the Paladin team or a trusted financial professional, because you're going to make sure people, like if they're in retirement, don't have all their eggs in one basket, aren't negatively affected, don't have to worry about a market correction like on Monday. But what you don't want to do, Jeff, is you don't want to be getting onto an airplane first thing Monday morning and hear your pilot say this.
It's interesting to be here. Flying down here is a little scary. They always have a pilot going, hi, this is your pilot. Before we take off, I just want you to know I invested a little money in the stock market. And let's see if those insurance forms pay off.
That was actually Robin Williams from The Tonight Show from years ago. But when he happened to be on a week when the stock markets had a big correction.
Sure.
And so he made that joke because he's always so quick.
Yeah, he is.
I had to play it today, though. It made me think of that one. Fun. I thought you'd enjoy that. But let's get into our show today. You've got a great one here. This is the month of August, and we're talking about healthcare.
Yes. Healthcare, big topic. As we've talked about on the show in the past, it's the largest expense people are going to face during retirement.
Sure.
Right. So we want to make some smart decisions, do everything we can to put us in a positive light, make sure it doesn't negatively impact our retirement any more than it has to.
Right.
Yeah.
Yeah. That's huge. And obviously, healthcare costs are a concern for people. I know that a lot of people don't even realize how much they're going to end up spending on healthcare in retirement.
Yeah.
Because Medicare doesn't pay for it all. But shed some light on the current landscape out there and things people should be aware of.
Yeah, a couple things. Number one, CNN just put out an article and it said the average cost of healthcare during retirement is $300,000
Wow.
for a couple. Yeah.
Wow, that they'll spend in retirement on healthcare.
Yes.
That's crazy.
Yeah. So it's a big number. That doesn't even include long-term care, Tony. That's just your premiums, your out-of-pocket expenses, everything that goes into it, your Medicare costs, all of that is $300,000 plus. If you're unfortunate enough to have to utilize long-term care, you need to add that in as well, which is just an additional expense. And I say on average, that's about $200,000 per couple, 50% chance of going into a care facility. So between husband and wife, one of them is
probably going to end up
going to go in, and you're looking at a couple $100,000.
Yeah, both my parents are now in long-term care.
Sure.
And my mom needs really serious long-term care, and it's $11,000 a month.
Wow.
So yeah, and long-term care, we've talked about that before, but like you say, that 300,000, people are like, well, why would I spend that much in retirement if I have Medicare? But people don't realize there are still premiums, deductibles, out-of-pocket costs. Maybe there's a prescription that your plan doesn't cover.
Correct.
Or that Medicare won't cover all of it.
Yep.
And, some of these medicines are getting outrageously expensive.
They're not getting any cheaper. I mean, when we do a financial plan for a client, I increase healthcare costs by 5.5% per year.
Sure.
Right. That's just, it's expensive. The costs are going up, not getting any cheaper.
Yeah.
So the best thing you can do is really just start planning early. The best way to really do that is by contributing to an HSA account if you have one available.
Sure.
So there's that. The other thing I think is important while you're working and have coverage, be sure you're reviewing that every year when your plan comes up for renewal. We've talked about this in the past as well. If you know you have major medical expenses coming up, maybe it's a knee surgery, right? Something and is planned, you may want to switch your healthcare plan for a given year to meet your expected healthcare costs and help you, better manage that as you move into retirement.
Sure. You have to look at what things you're going to have to cover that Medicare doesn't, and you might want to look at using an HSA for these things. You're right. Health savings accounts, Jeff, are amazing because they're the only account or a type of savings that the IRS allows you to put in money tax-free. So you get a tax break on the money going in.
Correct.
The year when you put it in, but it also comes out completely tax-free. So you never pay tax on that money.
Yeah, absolutely. We like to refer to that as triple compounding, right? Tax deduction on the front end, tax-deferred growth, and tax-free upon withdrawal. And you really can't contribute too much because, like we just said, $300,000, not even counting long-term care costs.
Yeah.
So just think about the tax savings on that. If you had $300,000 you're not paying taxes on in a 25% tax bracket, that's
huge.
75 grand right there you saved.
Yeah.
And that's not even counting the growth and everything else that goes into it. So it's a huge opportunity.
because the HSA is a growth account. Typically that money is in has some type of growth attached to it. So, and you don't have to pay taxes on any of it. What you put in, the growth, what you take out, that's pretty amazing.
Yeah, it's big, and you can contribute quite a bit for 2024, right? They do have deductibles. Minimum deductible for an individual is $1,600. Double that for a family. Contribution limits, $4,150 for individuals, $8,300 for a family, and those are already out there as far as increasing for 2025, $43 and $8,550. Not to mention the over age 50 catch-up contribution, so you can put another $1,000 in. So it can add up quickly.
Yeah, I like the catch-up contribution once you're over 50 because I'm definitely in that boat. Jeff.
You are?
Yeah. I mean, I realize you're probably not.
I must have missed a couple of birthdays.
Yeah. The invitation to the party's in the mail. That's for sure. So obviously, we're talking about things like Medicare, healthcare costs, HSAs, which are a huge tool if you can have access to them. Not everybody is going to qualify or be able to have an HSA. But if you're able to have a high deductible insurance plan through an employer,
Yep.
you can get an HSA typically.
Absolutely. Yeah. Great opportunity. And then, of course, most people count on Medicare at some point, right?
Right.
Which is also can be confusing. We happen to have a Medicare specialist in our office.
Oh,
Miss
that's
Nikki Foley.
yes. Nikki helps people with Medicare figure out what can I get that will cover the things I need, because Medicare itself does not cover hearing, dental, vision. It doesn't cover long-term care.
Yeah.
So there are a lot of decisions to be made, and what drug plan is going to cover most of my drug costs, what I need.
Yeah.
And so everybody's situation is different. And now there are options, right? Like Medicare Advantage,
Yep.
which some Medicare Advantage plans cost little to nothing.
Yes, it really depends. Again, why you need an expert. You have your Part
Right.
A, that's basic, right? That's your hospital, skilled nursing, some home health care.
Yep.
Part B is your outpatient doctor visits. You have your Part C, and that's what you were talking about, your Medicare Advantage plans. Parts A and B, private companies. Part D is your prescription drugs.
Yeah.
The big thing is to, again, make sure you're working with an expert. It can be a little complicated. And one of the big decisions you want to make is if you have a preferred doctor, right? Some people don't. I don't have one at this point, a doctor I see regularly, but if I did, you're going to want to make sure that he's in network based on the plan you choose if you want to stay with him or her as your primary care physician. So a lot of things go into that as far as eligibility and what you qualify for.
Yeah, I have a primary care physician that I see and like.
Yep.
So I would want to make sure I'm on a plan that includes him and the facility he's at, which is near me where I live.
Yes.
And especially in retirement, you want somebody close by typically. But even when you're not in retirement, you mentioned in network. My daughter got sick and went to the doctor. She didn't tell us she's on our plan, but it was out of network.
Sure.
You would not believe the bill we got.
Oh.
I mean, it's insane.
Yeah.
Right. I mean, and we're like, why isn't insurance covering this? Oh, it wasn't in our network.
Yeah. Or if you travel, right?
Yeah.
That comes into consideration too.
Yeah.
So,
We sat her down and said, you can't get sick. You're not allowed. But if you do,
yes,
you have to go to these facilities or these hospitals or clinics. So, yeah.
It's something you just want to be aware of, right? Your
Right.
your current health status, drug needs, overall budget.
Sure.
Enrollment periods come up every October,
yeah.
right? So you have renewal opportunities, plans change. It's getting more and more expensive. There's articles about how they've miscalculated some costs, so costs can go up. Things to consider. You are paying it's under certain income limits. It's $174 a month, right? So you also want to be conscious of that income limits so you don't bump up over IRMA, because $1 over the amount increases your costs. Right?
Sure. So the price you pay for like regular Medicare costs money. There is a premium,
Correct.
Right? For Part B, and so that's basically 174. But if you make above a certain amount, that amount starts to go up, is what you're saying.
Yes.
And some people have to look at that cost because it might not be worth it to. They have to maybe make some adjustments so they don't bring that up. And that's
Correct.
called IRMA, that increase.
Yes.
If you make more money, you pay more for Medicare premiums. So, Aunt Irma reminds me of my Aunt Irma. I don't know, again, why does the government name these things?
Well, the other thing to consider too is they use your income from 2 years prior to determine that.
Ah, that's right.
So you want to look at that as you're approaching age 65. If you can monitor your income and make sure you don't have a huge increase in income during those 2 years prior or even throughout, you want to monitor it.
Sure.
Make sure you spread it out so you don't end up paying more than you should have to.
Yeah, that's smart. That's something to consider into your calculations when you're looking at income or pulling money out of retirement accounts in retirement.
Correct.
Yeah. Okay.
Correct. So there's things you can do.
Sure. So what else should we be considering?
The other thing to look at is if you're planning to retire prior to age 65, right? You don't qualify for Medicare until then. So you're going to have to get some sort of private insurance to get you from, let's say, 63 to 65.
Sure.
Until that kicks in. So again, based off of income, if that's part of your retirement plan,
Right.
your advisor should be looking at that and considering healthcare costs and how you're going to, monitor your income, where you're going to take your retirement income from to make sure you don't bump up into another level of Medicare expenses down the road, and you keep your healthcare expenses at a minimum by reducing income in those years.
Sure. And especially if you're married, you have to consider your spouse if you want to retire early, because let's say you're married and your income, your company provided the health insurance for you and your wife or
Yes.
you and your family. And you're like, but I'm going to retire early. Well, now you not only have to find health insurance for yourself, but health insurance that will cover both you and your wife.
Correct. And maybe your kids.
And
these days as well.
maybe your kids. I mean,
Yeah.
up to age 26, I think it is, that they can stay on your insurance.
Yeah. So you
yeah.
want to take a look at all of that. And it's a little bit different than Medicare in that if you go and you apply for private health insurance, or you go through the ACA network
Yep.
and try and look for that, the Affordable Care Act, they're going to ask you what your income is going to be. So you have an opportunity to make sure it's reduced in that year you start receiving private health insurance.
Sure.
To get it reduced. They don't look back 2 years prior. So that's just at the
So the
time you
Affordable
apply.
Care Act, when you go to the exchange to find affordable insurance, well, I'm going to put affordable in quotes because health insurance is outrageously expensive, or can be.
Yeah.
But you really need to consider that. That's good that they don't look back,
Yes.
because what you were making at your peak earning years 2 years earlier, but what you're going to be making when you need it after you're retired.
Yep.
Yeah.
Yeah. I had a new client come in, and they had a couple $1 million in savings, done very well for themselves, saved well.
Yeah.
And he was living off of, I want to say it's $30,000 in income. So I asked him, I said, you've got all this extra money. Why are you, living so tightly? He said, well, because my healthcare costs, I don't pay anything for healthcare if I keep my income under a certain level. So he had strategized and was keeping it down until retirement, and then hopefully enjoy himself a little bit more after that.
But the discipline could pay off.
Yes,
Yeah,
absolutely.
Especially if you're thinking about retiring early, you have to be disciplined, and you can't do it without working with a financial professional.
I wouldn't recommend it. There's a lot of moving parts.
Yeah, there's a lot of ways to make costly mistakes if you're going to retire before your full retirement age. Even if you are going to retire at your full retirement age, you need a professional on your team.
It definitely helps. Definitely helps.
Yeah. It helps in times like Monday when the stock market is
right.
They're screaming the sky is falling, and you're like, oh man, I better pull everything out of the stock market. But if you have a financial advisor like yourself, Jeff, you take the emotion out of it for your clients. You're like, no, that's not part of the plan. You don't need to worry about this at all. Correct. Because we have you allocated this way. And
hopefully they don't even call panicking, because they understand how they were set up initially. But we always welcome phone calls.
Sure.
Anytime
they might have questions like, hey, should I be worried about this? And
Happy
then you can explain, no, here's what's happening. Here's why this went down. And 100%. Corrections are normal.
Yeah. Happens on average. I have every 20 months.
Yeah.
I believe is the number for a 10% decline in the market. What's called a correction.
Sure.
Happens all the time.
Yeah.
We have a chart. If anybody want to take a look at it, give us a call. You can send out, and it shows year end growth in the market in years where there was a 10% or more decline.
Right.
So it happens all the time. And if you just hang in there and hang tight, it typically comes back fairly quickly, especially like look at this last time, just this week, it almost came back already.
Yeah.
So you want to hang in there and don't make any rash decisions. That's what we're here for.
Right. And healthcare planning, though, is so important. And so many people don't properly plan for healthcare and retirement before they get there. And that's the key, right? Don't do that. Make sure you plan ahead of time.
Yes.
Yeah.
Yeah. And then, of course, we talked about healthcare. We also have the major, that's 300,000, according to latest studies.
Yep.
Don't forget about long-term care, right?
Yeah. How are you going to cover that? I mean, and there are strategies and ways you help people prepare for long-term care costs too, right?
Yeah. There's really, in our opinion, there's three options, right?
Okay.
You can just pay for it out of your pocket,
Yeah.
right? You got a $200,000 bill coming. I always say, how would you like to pay for it? You may just pay for it out of your investments, your retirement savings.
If you have enough saved and you have, 200 grand is not going to be a problem.
Yeah.
And it's money I don't want to leave to my kids.
Yeah.
That's my thing about paying for long-term care. Then a lot of people don't have enough saved to cover long-term care and have something left over.
Yeah, if you bought, and we'll talk traditional long-term care, if you bought it at a young age,
Yeah.
it might be fairly affordable.
Yep.
Challenges, they do increase quickly. I know I had clients receive statements recently that had long-term care policies from a long time ago, had them for 15, 20 years.
Yep.
Well, those costs are increasing by 50%
Yep.
over the next couple of years.
Yeah.
Right. So, some of it was misjudgment on the insurance carrier's part.
Sure.
A lot of that, a
Yeah.
lot of companies don't even offer it anymore.
Right.
I used to say this, Tony, if you ever wanted to go into sales, try selling something that is extremely expensive, right?
You might not get anything for.
You might not get anything for it. And if you do get to use it, it means you're in a care facility, right?
Yeah.
So nobody wants any of that. It's expensive.
No. Nobody wants to talk about it. Nobody wants to pay for it.
Right.
So traditional long-term care insurance is what we're talking about here. And what you're saying, Jeff, is that traditional long-term care insurance, it's kind of going the way of the pension, going the way of the buffalo, right?
Yeah.
It's harder and harder to get. It's more and more expensive.
Yep.
And those traditional policies, you pay huge premiums and you might never use it.
Correct.
And you don't get that money back. You're not earning money on that money that you're putting it in. And
you don't even want to use it,
no,
right? Because that means you're in a care facility.
Right.
So you hope you never use it.
Yeah,
and
that
if
is
you don't,
crazy.
You get nothing for it.
Right. But there are alternatives.
Yeah.
There's some good ones. The insurance companies have realized this.
Yep.
So they've really made some attractive alternatives for it. And I know my mom and dad are utilizing a little bit of some of the alternatives, the long-term care riders, where you have a cash value life insurance policy, right? And you can use either some of the death benefit if you need it beforehand for long-term care, or
exactly.
I mean, there's different types of policies.
Yeah, call them hybrid life insurance policies, right?
Sure.
So it's got it's traditional life insurance policy with a death benefit, and then it has a rider or caveat that says, hey, Tony, in case where you can't perform, usually they're linked to 2 of 6 ADLs. If you can't perform 2 of 6 activities of daily living, we will allow you to accelerate the death benefit and use that to pay for long-term care expenses. So you're covered. You're going to get to use it. Somebody's getting the death benefit, or you're going to use a portion of that to pay for your long-term care. So you're not sacrificing potentially hundreds of thousands of dollars that nobody's going to get to benefit from.
Right.
So
that could be
popular.
Earning you money in a growth account somewhere, right?
Yeah.
Yeah. Or you can even have a cash value policy where you're putting money in to use for that, and it can grow.
Correct. You could do that as well, which typically allow tax-free loans. So you could pay for it tax-free versus your cash value. There are some annuities as well that will have long-term care provisions, again, attached usually to 2 of 6 ADLs, where they may double your income for a period while you're in a care facility. So that's an option as well. So there's a number of other options that we believe in most cases are a better fit than traditional long-term care policies.
Yeah, for sure. Yeah, it's good to know that there are different strategies, but it depends on each individual situation.
Yeah.
Depends on how much they have saved, what their goals are for retirement, which way they want to have long-term care covered and their healthcare costs covered.
Yes. Yeah. Right. And oftentimes when you lay the options out, you can look at it and people will lean one way or the other based on what they anticipate that total cost being and their lifestyle. The other thing I always want to point out is stay healthy.
Right.
That's the greatest.
That's a great way to
avoid it, right?
Yeah.
Do what you can. Yep. Stay active.
Yeah.
Maintain good health, weight, good diet, all of that stuff to help avoid going into a home or needing additional care is also a great preventative method.
So what you're saying, Jeff, is I should probably cut down on my trips to the pizza buffet.
Well, I'm not saying that, Tony. Remember, we're on radio here.
Yeah. Well, no, there's video as well. I see the cameras.
That's true.
I see the cameras, so I can't be hypocritical. I mean, people often ask me, I say this, Jeff. People say, Tony, how do you do it? Diet and exercise.
Absolutely.
Yeah. And my diet, unfortunately, includes way too many pizzas. That's the problem.
Pizza's
I've never
delicious.
met a pizza I didn't love, Jeff. That's the thing.
I can't disagree.
But you're right, though. For my kids, my family, my age, I've really been trying to eat more healthy, as I get older, I see that importance, and it is really important. I don't want to have higher healthcare costs when I'm in retirement, or for my family. I don't want to burden them. So it is important to stay healthy.
100%.
And I know we've talked about that. We had month about exercising. Nikki's had a few guests on about that.
Yep.
So staying fit is important.
Absolutely.
And for some of us, it's easier said than done, right? But
yeah, and it's not guaranteed, but it's definitely not going to hurt.
Yeah, definitely not. So at any rate, Jeff, this has been a great discussion. But before we go, let our listeners and viewers know how they can get a hold of you.
Yeah, 100%. You can always call us at 651-842-8406. We'd be happy to talk to you or connect you with any of our office experts on these various topics. And of course, you can visit us on the old information superhighway, if you will, at paladinfinancial.com.
All right, paladinfinancial.com. Check out the website. Thank you, Jeff, for a great show. And viewers and listeners, that does it for today's episode of Paladin Financial Talk with our host, Jeff Quick.
Thanks, Tony.